We're going to go over directional terms and imaging planes. Some of you might already be familiar with these if you've taken medical terminology or you already work in healthcare. These might be familiar to you, and that's fine. It'll just be a little brief overview. So, imaging planes and directional terms are really important in any diagnostic imaging career. These are something that we reference with every patient on a daily basis. The thing with diagnostic imaging is we are usually the only communication between the patient and the radiologist who's reading the images. Radiologists don't have much interaction with the patients unless they're doing a procedure with them. So it's really important for us to give a good, accurate history so they know exactly what's going on. So if there's an injury, if there's a laceration, if there's a mass or a lesion, we need to give very specific directional terms or information like that to the radiologist so they know exactly where that is occurring in the body. So it's going to give them a better understanding of what's going on with the patient and help them diagnose them. So these are three of the planes that are most commonly used, or three of the only planes that we use. So you've got, the first one is the sagittal plane, which is this one here, which is cutting the body into right and left halves. So sagittal plane is right and left sides. The coronal plane is cutting the body into anterior or front and posterior rear sides. The transverse plane can also be referred to as the axial or horizontal plane, is cutting the body into superior and inferior portions or top and bottom portions. It's cutting the body in half, kind of like just like a horizontal plane, like the horizon, it's going across. One of the most important things that we need to utilize as a diagnostic imaging technologist is anatomical position. So we reference everything back to this position, this anatomical position. So what it essentially is that the person is standing upright, they're erect, their arms are at their sides and their palms are facing forward or up, and their feet and toes are pointing forward and their eyes are looking straight ahead. So this lady here is standing in anatomical position. So when we're referencing images, when we're hanging images, we're always going to hang them so the radiologist is looking at them like they're in anatomical position. So when we're referencing the patient, it's going to be opposite of what we're looking at them. So this is her right side, obviously, and her left side. So her left side is going to be on our right side if we're looking at the patient. Her right side is going to be on our left side. So it's kind of always going to be backwards and opposite, and that's something that you have to get comfortable and familiar with. It takes a little time sometimes because it's backwards, but you'll learn to get it. So like I said, every time we reference anything or anytime we're hanging images for a radiologist, we're always going to put them in anatomical position. Some of the terms that we use that we call straight terms, one of them is anterior, sometimes referred to as ventral. Ventral is usually used more in animals than it is in humans. We do use it for a few things, but we usually refer to it as anterior when we're talking about straight terms for positioning. So anterior means in front of or the front of the body. And then posterior or dorsal, again, dorsal is kind of used more in veterinary or animals, and posterior is what we use on a more common basis. So posterior means behind or back towards the rear. So I think of, posterior, derriere, the rear. Kind of all helps me kind of get it all in my head sometimes. I always make up stupid little things that will help me remember things. So you guys can laugh at me or make fun of me, that's fine, but I try. I try to do something that helps me remember. Lateral means away from the midline. So the midline is kind of the center of our body. So lateral means away from that midline or towards the side. If anybody out there likes football or watches football, if you think about when a player has the ball and they make a lateral pass, they're just throwing the ball directly to their side to another player. So lateral means towards the side. Medial means towards the midline of the body or away from the side. Median kind of reminds me of middle, so the middle of the body. So medial is towards the midline or away from the side. And proximal means near or closer to the point of origin or the trunk. And distal means away from. So if you think of proximal and distal on a different way, distal kind of if you think of distant, like the hand is distal to the elbow, so it's further away in distance. Kind of sometimes helps remember. So some of the different ways that we can use these terms are the chest is anterior to the back, or the heel is posterior to the toes. Those are just some common ways that we can use those. As far as lateral and medial, you could say the arms are lateral to the midline, or the neck is medial to the arms, right? The neck is closer to midline than the arms. Or the shoulders are lateral to midline, right? They're to the side or towards the side of midline. And then when we get into distal and proximal, some examples for those would be the hand is distal to the elbow. The shoulder is proximal to the elbow. The foot is distal to the ankle. And the knee is proximal to the ankle. So those are just some of the examples of how we could use them in a sentence to maybe help you better understand them just a little bit. Some other straight terms that we use are superior and inferior. And some of the ways to remember these, I always think of, if you think you're superior to somebody, you think you're above them or higher than them, right? You think you're better than them. So superior describes a position above or higher than another part of the body. So superior body part, you think you're above them. Inferior, a lot of times if you feel like you're inferior, someone's looking down on you. So inferior describes a position below or lower than another body part. So some of the ways that we could use those in a sentence are the hands are superior to the feet. They're above the feet, right? The abdomen is inferior to the chest because our abdomen is lower than our chest. The elbow is superior to the wrist. And the knee is inferior to the hip, right? Because the knee is below the hip. A couple other terms that we can use that refer to towards the head or away from the head are cephalad. Some people say cephalad, some people say cephalad. Either way is fine. But cephalad means towards the head. And if you've taken medical terminology, cephalad means the brain. Like encephalitis would mean swelling of or inflammation of the brain. So cephalad is towards the head, and then caudal is away from the head and towards the feet. Some compound terms that we will use are ipsilateral, which means same side of the body. So the right hand and the right leg are ipsilateral. They're both on the same side of the body. Contralateral means the opposite side of the body. So that would be if you were referring to like the right hand and the left leg. And then bilateral just means both sides. So if you're looking at both hands, both feet, both kidneys, something along those lines, you're going to be looking at bilateral hands, or you're going to be scanning bilateral kidneys. So here's a little reference image that kind of gives you an overview of what that means. So unilateral means one side. Okay, so we're only looking at one side. Uni means one. Bilateral means both sides, so both legs here. Ipsilateral means on the same side, so you've got the right hand, right leg, and then contralateral again means opposite side, so you've got left arm, right leg. So some of the different imaging planes that I kind of talked about earlier we'll break down a little bit more. So that sagittal imaging plane was the plane that divides the body into right and left sides. So when you refer to a sagittal plane, it doesn't necessarily mean equal. Sagittal plane can be any plane cutting through right or left, cutting the body into right or left sides. So it can be, 3/4 of the right side and 1/4 of the left side. Any plane that's dividing the body into right or left halves. So the median or mid-sagittal plane is the anatomical plane that divides the body into equal right and left sides. If you think median, middle, or mid-sagittal, they can be referred to as either term. It doesn't matter. So you may see sometimes the test or material refers to it as the median plane, and sometimes it's referred to as the mid-sagittal plane. Both are correct. Both mean equal right and left sides. Now, that's the difference, and that's where it gets a little bit tricky, because both the sagittal and median planes are dividing the body into right and left sides, but the median is the only one that divides it into equal right and left sides. A sagittal plane can be any plane that divides the body into right and left sides. It's not equal. So make sure you know that if you're asked on any of the material, test or quiz or anything like that. A coronal plane is dividing the body into anterior and posterior portions, so front and back. So that line, that coronal plane, is actually going through the coronal suture in the skull. So kind of from, like if you went from your right ear over the top of your skull to your left ear, that would be the coronal plane essentially. And it's, like I said, cutting the body into front and back portions, or anterior and posterior portions. So what does that mean the mid-coronal plane is? The mid-coronal plane divides the body into equal anterior and posterior sides. So again, a coronal plane can be anywhere in the body, dividing it between anterior and posterior sections, but the mid-coronal is equal anterior and posterior sections. The last imaging plane is the transverse or axial, and again, it's sometimes referred to as horizontal. That's a plane that's dividing the body into superior or top and inferior bottom portions. So that is perpendicular to the sagittal and coronal planes. This is kind of a little diagram of the different planes here, so you can kind of see, again, a visual. So this is the mid-sagittal plane here because it's dividing the body into equal right and left halves. And then any plane that would run parallel to that is just a sagittal plane because they're not equal. The coronal plane here, this red line, is dividing the body into anterior and posterior portions. And then you've got your transverse, horizontal, or axial plane. I'm sorry, there's 3 different ones, but that's just kind of how it is. So this is dividing the body into superior and inferior portions. And one more slide here. So we've got, I know these kind of remind me of like panes of glass. I don't really like them, but so this plane right here is cutting through the body right here. Okay, so it's dividing the body into superior and inferior portions. So which plane is this? If you said transverse, axial, or horizontal, you are correct. Then we've got this plane here, which is dividing the body, you can kind of see it coming through right here, dividing the body into equal right and left planes. So what directional term or what imaging plane is this? If you said median or mid-sagittal, you are correct. Because I said equal right and left sides, it's either the median or mid-sagittal plane. If it was cutting it down here, it would be just a sagittal plane. This plane right here, we've got cutting the body through the anterior and posterior portion. So which plane is that? Cutting the body into anterior and posterior. That would be the coronal plane. It's hard to see if this is equal. It looks fairly equal. If it was equal, what would it be called? The mid-coronal plane, because that would cut it into equal anterior and posterior parts. These are some images that we'll look at, and you can kind of see the difference in what the directional terms mean when we're actually looking at images. So this is an MRI of the neck. So here's the brain here, and the spinal column here, and then you've got your vertebrae here starting at your cervical and then going down into your thoracic. So this is a sagittal image from MRI. So a lot of times I say sagittal is the side view, SS, sagittal side. That kind of helps me remember. So it's like you're cutting that patient into right or left sides and then you're looking at their body from that direction. This is a sagittal view of an ultrasound. I know this one's a little bit harder to kind of get an understanding, but if they're scanning from this side here, then it's looking from the side. So it would be a sagittal view. This is a knee MRI. This is a side view again. And you can kind of see everything here. This patient has a mass right here, right underneath. This is their patella. So it's right, the mass is right underneath the patella here. But again, a sagittal view is a side view, dividing the body into right or left side. Again, one more sagittal view, and this one kind of makes it a little bit easier to understand. So you've kind of got that face here, which gives you an idea of what it looks like from the side. And this one's even better. So this would just be a sagittal plane, right? It's not mid-sagittal, because mid-sagittal would be right down the middle. But it gives you a good visual of what a sagittal plane would look like, how they would cut through the body. This is a coronal plane. So again, we have an MRI. This is the posterior portion of the patient. So you're looking at them from the back, brain, ears, neck, shoulders. So this would be a coronal plane because it's cutting the body into anterior and posterior portions. Here's another coronal plane. I don't know if you can tell what you're looking at here, but this is actually looking at the patient from the front, from the anterior portion, and it's their face. So here you've got orbits right here. Here's the right orbit and the left orbit. And then you've got sinuses, nasal passages in here, more sinuses here. The black is air in here in the sinuses. That's why it's all black. And then the mouth down here. So this is that coronal plane looking at him from the anterior portion. Another coronal plane, remember, cutting the body into anterior, posterior portions. So you've got spine here, brain stem, brain, and kind of where the orbits would be. This is another coronal MRI. You can see the body. So you've got lungs here, lung, liver. You've got the head of the humerus here, the bone, the humerus coming down. You can see all the muscle around it. You can see the trachea where it branches off into the lungs on each side. So this again would be that coronal slice. And here's another good visual of what it means to be coronal. So kind of cutting that front anterior portion of the face off. Again, if it was going through the middle and it was equal anterior and posterior portions, it would be the mid-coronal plane. And the last plane is transverse, axial, or horizontal. So this is cutting the body into superior and inferior portions. So it's like we're looking kind of like at a body cut in half. So this is a CT. You've got your back portion here. So this is the patient's back, spine. You've got a kidney here, liver, intestines here, There's some contrast in there. So this is the axial plane. There's a few different ones here. So another axial plane of the brain. So if you're cutting the top of the head off where the skull cap is, took it off and looked in there, I know that's kind of graphic and weird, but it kind of helps you understand just a little bit more what that plane is like. This patient actually has a mass right here, and then there's fluid all the way around it. I don't know if it's blood or other kind of fluid, but it's hard to differentiate. One more here. So this patient has a very large mass that's actually pushing. When we talk about midline, sometimes there's actually a midline in the brain, and you can see it here. What it does is it divides the brain into equal right and left sides. But what happens when there's a mass in there, it's pushing on it. So right here, it's starting to push that midline over. We call that the midline shift. And you can see it here a lot more. So here's your midline. This is actually putting pressure on the ventricles and closing them off, and it's shifting the midline way over here into the left side. So see why it's important for us to know what's going on, because we need to tell the radiologist. Yes, they can look, they can usually tell, especially if it's marked, but we need to tell them where that mass is located so that there's no room for error. And again, another good diagram. I like the ones with the face on it because it really gives you an idea of how the planes are. So this is transverse, axial, or a horizontal plane. And then the last image here is of the liver and the stomach and the spinal column back here. So that's the end of directional or anatomical planes. If you have any questions or concerns, go ahead and reach out to me, let me know, and I'll get in touch.